So thank you so much for taking your time to join us this morning for this webinar, Parents and Caregivers Experiences of Caring for Their Preschool Children After Declining Vaccines. My name is Jackie Eaton, and I am the Community Action Program for Children, or CAPC, Training and Education Coordinator. And I'm also a member of our early childhood team, which is responsible for inviting Dr. Hewell for this webinar. And before we begin, I just want to take a moment to talk about a couple of things. This webinar is being recorded, so when you joined, you should have got a message saying that. And once the recording is available and on our website, I will send the link directly to each of our registrants. You have all been muted for this presentation, but if you have any questions, please use the Q&A button at the bottom of your screen. And Christine is going to answer the questions at the end of her presentation. If you have any technical questions or want to connect with the participants, please feel free to use the chat and I'll be monitoring that. If you wish to turn off your chat, because I'm one of those people that doesn't like to see the rolling scroll, you just go to your chat button at the bottom of the screen, and on the right-hand side, if you click the arrow, it says show chat previews, and just make sure that there is no little arrow beside that, and you won't have that. All right, so to get us started in a good way, I want to take time to pause and just ground myself and think about what the land means to me, and I invite you to do the same. For this webinar, I am honored to be on Treaty 6 in the homeland of the Métis. I work at the Saskatchewan Prevention Institute, and we are a provincial nonprofit organization located in Saskatoon. But we provide services to all those on treaty lands 2, 4, 5, 6, 8, and 10, the ancestral territories of the Nahiawuk, Nahinawuk, Nahithawuk, Ananeshbek, Nekaway, Dakota, Lakota, Nakota, Dene, and the homeland of the Métis. We recognize that these lands are currently inhabited by Indigenous peoples from all across Turtle Island, including many other First Nations and Inuit peoples. And we acknowledge the importance of the treaties, the lasting impacts of colonialization, and continued inequities. We are dedicated to moving forward on a shared path of reconciliation and partnership. We are all treaty people, and we are grateful to live, work, and play on this land. So I invite you to take a moment to consider what land you are currently participating from and what that means for you. So we are so delighted to have Christine with us today. And before I introduce her, I just want to share a video sharing a little bit of what the Saskatchewan Prevention Institute does.
Think about the role you play in creating environments and opportunities that support children, youth, and families. As a provincial nonprofit organization, we support service providers, educators, and communities to increase the health and well-being of children, from preconception through childhood. At the Saskatchewan Prevention Institute, this vision has guided us since 1980. We offer more than just information. Our unique approach turns research and evidence into practical, easy-to-use resources that will inform your work and can be shared with families and communities. We also provide education and training opportunities on a wide range of topics to help you stay at the forefront of best practices in your field. Visit us online to learn more about how we can support you in building healthier communities across Saskatchewan.
Imagine a world where every child grows up healthy, safe, and able to achieve their full potential.
Our goal is healthy children.
I'm very pleased to have Dr. Christine who will present for us today. Christine is a family nurse practitioner and assistant professor at the University of Saskatchewan's College of Nursing. She has been a registered nurse since 2002, with extensive experience in pediatric and maternal child health, as well as primary care. She completed her PhD at the University of Victoria in 2024. Over the past 20 years, Christine and her family have lived and worked abroad with embassies and humanitarian organizations in post-conflict and post-disaster settings, experiences that strongly inform her clinical practice and research. In addition to teaching, Christine continues to practice as a family nurse practitioner. Her research interests include routine childhood vaccines and vaccine hesitancy, integrative health in primary care, intensive parenting, and how families navigate health and care in increasingly complex and digital contexts. We're very grateful to have you here with us today, Christine. I pass it on to you.
Thank you so much for that introduction, Jackie. I appreciate it. I'm going to share my screen here so everyone can see my slides. And open it up into my presentation mode. And I'll swap this around here so you're not having to read my notes here too. Here we go. So good morning. As Jackie mentioned, my name is Christine Uel, and I'm the first author of the JBI Qualitative Systematic Review titled Parental Experiences of Caring for Their Preschool Children After Declining Vaccines. The research team consists of myself and doctors Karen McKinnon, Gillian Harding, Roy Hagiri-Vijay, Carol Gordon, and Shannon McDonald. And I just want to provide a huge thank you to Jody Shinkarik and Jackie Eaton from Saskatchewan Prevention Institute for taking interest in my research and my work and welcoming me as a newcomer to this province by inviting me to present to you today. I want to disclose that neither myself nor the co-authors have any conflict of interest to declare in relation to this presentation. Myself and the people that I worked with on this presentation do receive federal monies from tri-agency funding like CIHR for research related to vaccines. But have no monies coming our way for our research that is tied to any kind of commercial interests. I have 2 children. They are fully vaccinated with everything on the routine schedule, plus a lot more because of our travels abroad. But I also do have people in my world, close friends and family members who do not believe in vaccines. Okay, so Jackie's already provided a land acknowledgement, and but I just want to disclose that I am also situated on Treaty 6 territory and the homeland of the Métis. And I just wanted to share, to start us off in a good way, share this picture with you. This is a nurse taking a blood sample from an Indigenous boy at the Alberni Indian Residential School in Port Alberni, BC, as part of a series of nutrition experiments conducted in residential schools between 1948 and 1952. And as I am a settler who was a public health nurse and currently practices as a nurse practitioner and as an assistant professor, I will tell you that I am definitely in favor of vaccines. I've probably, because I've given thousands of vaccines to people in different contexts and have that lived experience of seeing those people come back to me healthy and unharmed. But I am no stranger to the fact that people do have valid reasons to question and fear immunizations, particularly Indigenous elders in Canada who have attended residential schools and remember having vaccines tested on them without their permission. And as much as healthcare professionals want to encourage immunizations, we also do need to understand this historical legacy before going into communities to administer vaccines. Vaccine hesitancy is completely misunderstood when we remain ignorant and unaware of our country's history of racially segregated healthcare and medical experimentalism. And so Like Jackie had mentioned in my introduction, that my family and I have been living and working inside and outside of Canada for the past 20 years. Prior to moving to Saskatoon, we were living and working in Beirut, Lebanon, with the International Committee of the Red Cross. And in all contexts that we have lived, I've worked with and met caregivers and parents who feel hesitant about vaccinating their children due to fears about the safety, effectiveness, and necessity of routine childhood vaccines. To this day, I still remember the first parents that I worked with who declined a measles, mumps, rubella vaccine for their 1-year-old son. This was 15 years ago, and like our current circumstances, at that time, we were experiencing a measles outbreak in Bosnia-Herzegovina. I became interested in exploring what vaccine hesitant parents and caregivers do for their children's health in relationship to that decision to decline vaccines when I was working as a nurse practitioner in British Columbia. I started to notice that families in my practice spoke about the things they were doing to enhance or improve their children's health and what they were doing to protect them from vaccine preventable diseases. And it was related to their decision not to fully vaccinate them. And some of the things that parents and caregivers described to me was, using complementary and alternative health modalities. Some were breastfeeding their children for 5 to 6 years. They used organic products, foods within their house, and they avoided daycares and preschools. And the caregivers and parents were not vaccinating, but they were using a lot of resources to go towards care work or health work or care activities meant to enhance their children's health and avoid vaccine preventable diseases. So just to kind of take this back a little bit, the most recent definition of vaccine hesitancy comes from the World Health Organization 2022 in their position paper. And they stated it is a motivational state of being conflicted about or opposed to getting vaccinated, and this includes intentions and willingness. And what's interesting about this new definition is that it presents vaccine hesitancy as a motivational state, not a behavioral one linked to people's actions. So, in short, there is expressing vaccine hesitancy and there is acting upon it. Not everyone who feels vaccine hesitancy has declined all or some vaccines. Some will go on to vaccinate their children, but there's kind of what is happening inside of people's minds, and then there's the actions connected to it. And so World Health has now put forth the idea that kind of doesn't connect vaccine hesitancy directly with not vaccinating yourself or your children. Our last federal coverage survey in Canada on vaccination was completed in 2022 from survey data collected from participants in 2021, including their provincial vaccination records. And at that time, only 2.1% of 2-year-old children had had 0 doses, 3.7% of 7-year-olds, and less than 1% of 14-year-olds. The frequency of the CNICS survey prior to 2021 was every 2 years, but we do not have updated survey data since this time due to COVID-19. But the evidence from this province, from Saskatchewan and worldwide, does demonstrate that since the pandemic, there have been further decreases in routine childhood vaccine uptake. And of particular interest in 2021 was the response from 42.7% of parents whose children had 0 doses that vaccines were just not necessary. And as I'll speak about a little bit later, this was echoed within our systematic review findings. So I mentioned my reasoning as to why I wanted to explore what vaccine hesitant parents and caregivers do for their children's health after declining vaccines based, anecdotally on my experiences in healthcare. But what I want to share with you today is how does this exploration actually add to what we know about vaccine hesitancy, or what healthcare providers and people who support parents and caregivers, what can we do about it? The rationale for the systematic review and my primary research on this topic was was born out of frustration. The research scape on the topic of vaccine hesitancy does not always fit what I experienced in practice as a registered nurse or as a nurse practitioner. Research on this topic echoes the perceptions about vaccines that parents have and their decisions or how they make those decisions. And the suggested interventions were related to sharing evidence about vaccine safety, fostering trusting relationships with parents and caregivers, taking time to ask about their fears, and being approachable, being calm and non-judgmental. And the issue that my colleagues and I had were the assumptions that parents' trust in healthcare providers was an all or nothing thing, and that evidence alone could convince them. I felt that parents and caregivers that I work with trusted me on many aspects related to their children's health, but vaccines seem to be in a different category. My patients, parents and caregivers are making links to things unrelated to their trust in me. So, they spoke about mistrust in pharmaceutical companies, governments, allopathic medicine, conspiracy theories, corruption, and then making decisions based on the mistrust of these institutions, not based on their trust in me as a healthcare provider. And much of what vaccine hesitance patients say is contestable, like harming the immune system, violation of civil liberties, or causing autoimmunity. It is not grounded in the evidence that informs our practice, but the evidence that healthcare providers share to refute these claims originates from those sites of mistrust that parents have deemed not reliable to inform their decision. In the current state of research on this topic and recommendations, in the past, I felt they were not supporting my practice or providing me with a different perspective on why this was happening. So our review team and my primary research project moved away from exploring the opinions that we disagree with to what vaccine hesitant parents are doing. So why do I care about this? I think I have an underlying belief or an assumption that sometimes actions do speak louder than words. And I was fearful that the frustration I felt for some of my, the parents I worked with was clouding a more expansive perspective on what is fueling this issue. Taking kind of a softer approach by shifting from looking at people's opinions about vaccines to looking at what they do for their children's health care. I wanted to highlight that parents are not taking their children's health lightly. And taking this approach didn't mean that I agreed with their perspectives and choices, but I wanted to pay attention to other aspects of this issue that may go unnoticed to understand it better. So for our qualitative systematic review, our objective was to synthesize qualitative research about caregivers and parents' experiences of enhancing their young children's health after deciding not to fully vaccinate them. Our phenomena of interest was to shed light on caregivers' work or care activities that ensure their children's health and safety and are connected to their initial decision to forego all or some routine childhood vaccines. We were interested in studies published in all languages from diverse contexts. As this was a qualitative systematic review, we were interested in studies that presented qualitative research findings, including mixed methods research. Our primary review question was, how do parents experience the specific activities involved in caring for their under-vaccinated or unvaccinated young children after refusing routine scheduled vaccines due to concerns about safety and efficacy? We were also interested in research findings about how parents and caregivers controlled their young children's exposure to vaccine-preventable diseases. We wanted to know about what care activities parents and caregivers used when their children became ill from a vaccine-preventable disease. And finally, we wanted to know about how parents and caregivers experienced this work. Who supported them, who provided this care within the family, and what were the risks and benefits associated with providing this care for their children. Our systematic review was conducted in accordance with the JBI methodology for systematic reviews of qualitative evidence. Our search strategy aimed to locate both published and unpublished studies. All database search strategies, including our search terms, subject headings, keywords, and mesh headings, were approved by University Research Librarian Dr. Carol Gordon. We included studies from 1998 onward. This particular year was chosen because it was the year that a published and then subsequently retracted research paper by Andrew Wakefield purported a causal link between the measles, mumps, rubella vaccine and autism. And this has been identified as a starting point for more modern vaccine hesitancy. Our theoretical guidance informing our process was derived from sociologist Dorothy E. Smith's writings about institutional ethnography and illuminating the invisible, everyday, every night work of parents and family caregivers. And so as you're hearing me present, you're hearing me talk about health work or care work. And just to orientate you as to what we mean by that, the notion of work in institutional ethnography involves the acquired skills and conscious intent. It includes, caregivers and parents' emotional thought work, as well as their physical labor and communicative actions. So Dorothy Smith had a different orientation as to what work is. And her research looked at things, invisible work, often the work that caregivers do inside of the home as caring for children is sometimes not seen as work. And she reoriented it as, it is work. If it involves thought and skills and conscious intent, this is work as well. So we appraised 40 studies reflecting qualitative research from 30 data sets for methodological quality. This included 33 journal articles, 4 master's theses, 2 doctoral dissertations, and a book chapter. All 40 studies met our pre-established required criteria for methodological quality and were eligible for inclusion in data extraction. 15 of the studies shared an overlapping qualitative data set with one or more of the included reports. So our team referred to these reports as companion studies. Companion studies were compared to ensure that their extracted findings and illustrations were unique to each study. The number of participants was an approximation because one of our included studies completed qualitative data analysis from social media. So the number of participants in that study was not available, but it was somewhere around 676 participants. The included studies had sample sizes ranging from 4 to 60 participants. Of the studies that reported on the genders of non-vaccinating parents, 324 identified as female, 56 identified as male, and 1 participant asked that their gender not be divulged. To our knowledge, none of the parents identified as transgender, non-binary, or gender diverse. Most of the studies that we included were from the United States. That was 14, and Australia, there were 9. We found 2 studies each from Turkey, Switzerland, the Netherlands, the United Kingdom, and Finland. And we had 1 study each from Canada, Croatia, Malaysia, Norway, Spain, Sweden, and Taiwan. From the included studies, a total of 115 findings were extracted and grouped into 12 categories based on similarities of meaning. These categories were then aggregated into 3 synthesized findings used in the process of meta-aggregation, which is part of the JBI methodology. Synthesized finding 1 was parental care strategies within the home, focusing on the individual and family. Synthesized finding 2 was parental care strategies within the community, managing social interactions and community networks. And finding 3 was parental care strategies at the systems level, challenging societal discourses and institutional work processes. Okay, so synthesized finding 1. This metasynthesis consisted of 6 categories and 64 findings. The major findings were that parents enacted a multitude of care strategies for their children after declining vaccines, which included direct health strategies for their children and within the home environment. Caregivers and parents used complementary and alternative health modalities. They also reported willingly exposing their children to vaccine-preventable diseases due to a belief that this conferred superior, longer-lasting immunity over immunizations and that the illness convalescence was important for their growth and development. Caregivers and parents discussed living natural lifestyles and fostering a healthy environment in their home to decrease the risk of their children getting a vaccine-preventable disease, and also under the belief that their children would have a stronger immunity to suppress symptoms should they contract one. Caregivers also detailed that healthy, natural lifestyles could decrease the severity of vaccine-preventable disease symptoms should their children become ill. They conveyed their confidence to take responsibility in caring for the children who became ill, mainly because of a perception that the severity of vaccine-preventable diseases were minor, and their experiences caring for a child with a vaccine-preventable disease. Finally, caregivers and parents reported that the decision not to vaccinate was not a final choice. Instead, parents described a very intensive ongoing process of searching for information that would either confirm their suspicions about vaccines or disprove them, in which case they may reconsider their decision. And I found this really interesting, this finding, because parents also mentioned how they were really trying to look within their community. They were looking for signs of increased risk of, say, measles. They were looking at the health of their children and the health of their family members, and they were actually reassessing their decision very regularly, both within their family and within their community, to determine if they might change their mind and decide to vaccinate, provide more vaccines for their children. The second meta-synthesized finding was formed from 4 categories with 32 findings. It reflects the descriptions in qualitative research that detailed how parents' care activities after declining vaccines extended broadly from that hands-on work they provided within the home and expanding into the greater community. Their decisions led them to anticipate difficult relationships with members of the community who may disagree with their choices. Parents and caregivers discussed how they would actively and passively respond to and manage relationships with healthcare providers. Actively, parents reported that they were anxious and worried about attending healthcare appointments with their children. They managed relationships in anticipation of an unwelcome response from healthcare providers who disagreed with their choices. Passively, parents would try and screen healthcare providers in advance to see if maybe they would be amenable for accepting their vaccine choices. They avoided healthcare encounters altogether, or they also just didn't disclose their vaccine choices to healthcare providers. Parents also managed, avoided, and prepared for the stigma they may face from friends and family members. Actively, they prepared themselves for arguments and made themselves aware of the online discourses surrounding parents who declined vaccines. And then passively, they stayed silent and just did not share their choices with friends and family members. Parents discussed the choice to homeschool their children after declining vaccines. Some were forced to due to laws about mandatory vaccines in their community. And they also did so because of the fear of catching vaccine-preventable diseases from newly vaccinated children. While guarding themselves against animosity, parents and caregivers also concurrently reached out to like-minded peers for support and information to guide the hands-on care they provided their children and to continue gaining knowledge about vaccines. And this is an area that I would love to dig into further in research, is the community building that happens amongst parents and caregivers who do not vaccinate, and turning to other people who have made the same decision for that kind of support. I think that while that community building confers a huge benefit to parents, it also kind of isolates and insulates them from other friends, family members, healthcare providers that have different views about vaccines, that might kind of provide that diverse opinion. So there's the benefit from that kind of companionship with people, but there's also kind of the negative point where it keeps them from other people that might provide perspectives that might be interesting or challenge their viewpoints. The third synthesized finding, this metasynthesis, was created from 2 categories and 19 findings, reflecting the broadest scope of caregivers and parents work for their children in response to their decision not to fully vaccinate. So when I say challenging societal discourses and institutional policies, that sounds really abstract, but what it comes down to is parents and caregivers reported contemplating immigration. Parents thought they might leave the country they live in due to mandatory vaccination laws. They became advocates for vaccine choices and informed consent and blogged about parental rights on online platforms. Some of these parents actually said by putting themselves out there to become advocates for parents being able to make choices about vaccines or decline, they felt like their family's safety was threatened by what they called pro-vax people. Caregivers and parents discuss how they would work to protect both their choices and their family's overall well-being from real and perceived punitive measures directed towards them by government agencies. So that's that second category there, managing punitive measures at the systems level. So they approached this by planning next steps, namely describing what they would do if penalties became too overwhelming. They discussed being subjected to fines related to not vaccinating. Many parents worried about being reported to Child Protective Services. Parents worked at filing vaccine exemptions. Parents, especially this was reported in research out of Australia, had to kind of reinvent their household budget or manage it differently because they lost the family tax benefits for not vaccinating their children. And in the United States, some parents also lost access to nutritional social programs because they weren't connected to a health care provider because they were worried about disclosing their children's vaccine status and being penalized for that. And many parents discuss what it was to manage the loss of childcare options when they have to work. So we approached this systematic review with two underlying assumptions. And I want to put this forth because this is, for anyone out there that's interested in doing research, you like to think that you're not biased to your assumptions about what you're going to find in information. And I felt that I knew so much about this topic, even going into this work, that I wouldn't have that kind of that I would be aware of this, but we did assume that caregivers and parents, activities would be detailed only in their descriptions of the hands-on work they did for their children within the home. Rather than, as we looked at the evidence, we saw actually, no, this isn't just within the home. This is in the community and in the greater society. Second, we also assumed that parents would be trying to reduce their children's exposure to vaccine preventable disease. And many of the findings in this research did substantiate that assumption. But however, we also saw that we had 11 findings that described how caregivers wanted their children to contract a vaccine preventable disease based on those beliefs that it would improve their health and immunity. And we felt that this was really important for healthcare providers to understand that parents and caregivers might hold the viewpoint that vaccine preventable diseases can be beneficial for children's health. So, oh, sorry. I am just going to backpedal that. I gave all the conclusions all at once here. So research highlighting care activities involving natural living, exercise, diet, and birth practices. This was interesting for us. The second finding here, the origins of caregivers and parents' care activities. There's research that has demonstrated that exercise, diet, birth practices, natural living have actually preceded parents' decision not to vaccinate their children. So namely that people who are already engaged in these kinds of activities before they become pregnant might actually be more likely to decline all or some vaccines and continue with these care activities or health activities for their children afterwards. And so this suggests that what people are doing or what the care activities that people discuss to enhance their children's health may not actually be totally related to that vaccine decision, but more closely linked to their perceptions about health and risk before they have children. And in our discussion in our systematic review, we found supporting evidence that linked caregiver vaccine hesitancy to intensive mothering or parenting, and that being closely associated with natural parenting, breastfeeding, consumptive behaviors, and decisions about vaccines. Researchers have also suggested that experiences of childbirth self-advocacy and prenatal education and adherence to alternative diets like veganism, vegetarianism, non-GMO, and organic are also connected to subsequent vaccine refusal. In our review, caregivers and parents' negative experiences that they discussed in the findings contributed a lot to the community and systems level categories. And I think, again, we went in expecting that maybe parents would be talking about those hands-on health activities that they did for their children to enhance their health as being challenging or expensive. But that actually wasn't the case. The most kind of negative experiences that we found from the research were at the community and systems level categories. The emotional and financial stresses that parents and caregivers discussed were related to, managing stigma that they experienced from friends, family, neighbors, anticipating and experiencing negative reactions from healthcare providers, and trying to protect their family from punitive government penalties. So regardless of the work that parents were enacting for their children's health, because of their choice not to fully vaccinate it, they were kind of locked into it's a very intensive health project for their children within the home, while they were on the other side trying to kind of push back against stigma in their communities and the institutions that threatened their rights to decline vaccines. And what's interesting is often these are the same institutions that have encouraged their empowerment to independently make health choices for their children in the first place. And, for those of you out there who are healthcare providers and have been practicing for a long time, you probably have seen this, this strong emphasis within our practice on shared decision making, making informed decisions, giving patients, a lot of information and the rights to determine their own health. And so we've also encouraged some of these health modalities that are connected not to vaccinating, like extended breastfeeding, healthy diets, all of this. And so we have to see kind of where that is a bit contradictory, how on some topics we are really pushing parents to be independent in their decision making and make informed choices, declining antibiotics or really questioning antibiotics to get ahead of antimicrobial resistance as an example. But then when it comes to vaccines, we then kind of want to stop that decision making and have people do as we have advised. There's a bit of a contradiction in that parents pick up on. Research that detailed parents and caregivers, namely those who would call themselves mothers, enacting precautionary consumption to mediate children's exposure to chemicals found in food, consumer products, and in the home. This was a big finding in this research. So in category 1.2, in that work that was happening in the home, living healthy, natural lifestyles, it really illustrated the work of parents and caregivers to enact precautionary consumption activities to eliminate the influence of toxins in their children's developing bodies. And precautionary consumption, vaccine decision making are happening kind of in tandem and within contexts where caregivers are inundated by media reports about unethical pharmaceutical practices, toxic drug supplies, opioid misuse epidemic, failures or challenges within our healthcare system, and environmental spills of toxic, chemicals into water supplies. All of this they are actively taking in at the same time that they are making these decisions about vaccines. And this does raise people's questions about how trustworthy institutions linked to these reports are. And this may give rise to beliefs about the benefits of that natural living to avoid what is perceived to be as contamination and the decision not to inject of what is perceived to be toxins into one's children. And like I mentioned before, something that was, kind of hopeful to us was having a systematic review that reiterated the fact that vaccine decisions are very rarely a one-time final decision on the matter. The findings that were made up in Category 1.1 ongoing information seeking indicated that caregivers continued to contemplate the circumstances and evidence that would change their mind. Caregivers and parents discuss new evidence about vaccines, family members' health or choices, making them vulnerable to vaccine preventable diseases, and outbreaks as reasons why they may reconsider their decisions. This finding replicates what other researchers have determined about how parents make vaccine decisions, and that vaccine uptake resides on a continuum. This indicates an inroad or a path of exploration for healthcare providers who maintain respectful relationships with families that decide to decline vaccines, which can be used to re-engage, discuss, and provide support. And two studies that we included in our review really brought forth realities of gender-based, economically and racially marginalized people to our attention, demonstrating that vaccine refusal amongst some caregivers and parents added yet another intersectional barrier they were experiencing when they were already struggling with discrimination. Many of the participants in the included studies described their feelings of mistrust towards the government. However, amongst caregivers and parents who are Indigenous, Black, people of color, or belong to diverse gender identities, gender expression, or sexual orientation communities, and have experienced racism or systematic discrimination by people or programs that represent governments, a greater reason exists not to trust vaccine programs. And there's no doubt that awareness of the stigma already experienced by parents who belong to racialized or marginalized communities and who choose not to vaccinate their children is important for improving health services. Further research exploration could be helpful to help foster healthcare providers' understanding of these health experiences, but doing it from the standpoint of this group of parental caregivers. And this kind of research would need to proceed in a culturally safe manner, directed by and in collaboration with and supported and agreed upon with the communities that have experienced historical and present day injustices. Okay, so based on the findings of our qualitative systematic review, we've made the following recommendations for healthcare providers. If possible, maintain relationships with parents and caregivers who decline vaccines for their children. Caregivers are continually questioning their decision and rarely refuse all vaccines for their children. Ostracizing caregivers pushes them towards like-minded communities that confirm their fears rather than offering balanced support on this topic. And I often hear from healthcare providers and, especially nurse practitioners, but how do we keep this in place if we're concerned about people in our practice that aren't vaccinated and could potentially transmit a vaccine preventable disease at the clinic? There are excellent guidelines provided by the Canadian Pediatric Society for healthcare providers on how to kind of set some boundaries or ground rules to communicate with families about if you suspect your child has a vaccine preventable disease, they've contracted something, or if they've been exposed, call the clinic first or call ahead before you bring them in, just so that healthcare providers and staff are able to attend to that and find the best way to reduce transmission from happening. Inquire about what parents and caregivers are doing for their children's health, and do this to foster a relationship with people who do disagree about healthcare providers' advice about routine childhood vaccines, but don't focus solely on the refusal. Ask them what they're doing for their children's health, what informs their activities and what makes these information sources trustworthy for them. And I this finding is really based on just trying to keep that relationship intact. If our relationships with our patients are solely focused on what they are not doing, or the refusal, or when they decide to go against the health advice we're giving, can imagine how difficult that relationship comes when we want to provide care in other facets of their health. Attending to what they are doing for their children's health, though not agreeing about vaccines, at least gives parents an opportunity to feel that healthcare providers recognize the efforts that they do for their children's health, however misguided they might be in the case of wanting vaccine preventable diseases to improve health. I understand that some of these ideas fly in the face of our beliefs or what we know is supported by evidence, but healthy diets, exercise, sunshine, the other things that parents are trying to do are something to pay attention to. And finally, recognize that parents who decline vaccines are anxious or fearful, and ask about especially when they're asking about vaccines or if their child is ill. We should recognize that parents may have had very negative interactions with healthcare providers due to their vaccine decisions in the past. And, parents and caregivers do spend time and effort to try and mentally prepare themselves for healthcare encounters, or they might even avoid them altogether, which is very risky for their children's health. So, this happens all the time where I'm in a public place and I have ran into someone that I've cared for in primary care, and they're like, oh, they remember everything that happened, our interaction, and I'm kind of looking at them, and I realize that as a healthcare provider, when you're seeing and caring for so many people, we don't often remember these snapshots in time where maybe we have a more difficult conversation or react negatively to what people are saying to us. We might not remember it, but they do. And it is something that that interaction is determining how much they want to engage or how much information they want to share in the future. So just being aware of that snapshot in time, that encounter with the patient that you have, they have been preparing for maybe for days and feeling anxious and planning what they're going to say because they are fearful of your reaction. And this can keep people from accessing care even when their children very desperately require it. Okay. Thank you very much for your attention. Questions are welcomed and appreciated. I do have JBI best practice information sheets. Those are available through JBI and they're open access for anyone who is interested. I'm going to pop up this slide here. This will take you to my profile at the University of Saskatchewan, or if you want to take a look at the systematic review and the best practice information sheet, scan on the left-hand side of the screen there. I'll just leave this up for a second. And I will stop sharing and answer any questions you have. Great.
Thank you so much, Christine, for amazing presentation. Just really appreciate your knowledge and your willingness to create a different picture. I think I am not a healthcare provider, but I can understand the mistrust of certain things, especially because of media and the way our world is, and that trust of because things have happened in the past. And so I appreciate you bringing all of that sort of to the forefront and really acknowledging these parents want the best for their children. It's not the decline of a vaccine is not because they want their child to not be well. It's because they are trying to identify other ways. So,
Yes, absolutely.
hey, I see Jennifer has raised her hand. Oops, now I can't find her. Where is she here? Oh, she took it down. So, okay. We don't have any questions currently.
No problem. I'm really, I mean, even if it's something related to this or not directly related to my research, I'm happy to answer questions, particularly on this topic, for anyone that wants to weigh in, or if someone has an experience that they would like to share. I'm all ears. I'm always interested to hear about people's experiences with this.
Anyone would like to? Okay, now let me just see if I can. Here we go. Okay, and I apologize if I'm not saying your right name, Dushima. I'm just going to allow you to talk.
Good morning.
Good morning.
Yeah, okay. So, I want to ask about vaccines.
Mhm,
So, I know like sometimes there's a misunderstanding about vaccines. Sometimes they will say when when some diseases or maybe sicknesses sprang up, some people
mhm,
tend to say it's about maybe some vaccines that are not so good for the kids. That's what like is causing it or something. I
mhm.
don't know if that's something you want to talk about.
Yes, and so I think what I've seen in practice, and when I also chat with colleagues, because because this is taking place, and public health nurses, primary care providers, especially pediatricians, are very aware that people have these concerns about vaccines. Sometimes what can happen is that providers will come across at really pushing the benefits of vaccines without also paying attention to also mentioning the risks of vaccines as well. And they do that because they do understand the risks, but they're also concerned about sharing that information with parents and caregivers might make parents and caregivers focus on that versus what would be the benefit of having the vaccine. The issue with that is that it does the opposite. Whenever as you probably know in healthcare, anytime a healthcare provider paints a picture of something being completely beneficial, it's often very received by parents and caregivers as being a bit not trustworthy, because we understand that there's risks in everything. And so what I like to mention to my patients is, like any medication that I prescribe, there is always a risk with that medication. Someone can have an allergic reaction to it. They can have an adverse effect that with that medication. Perhaps they're taking another medication that I don't know about that it interacts with. There is always that risk. But the reason I write the prescription for that medication is because I believe that the risk of having that of taking the medication is much less than not having it. And it is the same with vaccinations. Vaccines are not 100% safe, as we know. Patients can have an allergic and anaphylactic reaction to a vaccine if they have particular allergies. We know this information. However, the risk of someone having that reaction versus the risk to a child having the disease is much lower. Is much lower. So, I think that the vaccines that we are providing children are safe. They are very rigorously tested, and we, even as they're being provided, healthcare providers and people at multiple levels within our healthcare system are watching to see if there's any kind of notable different side effects or adverse effects. But I do understand how people can become, worried about it or concerned that they're unnecessary or they're harmful for their children's health. But the disease risks are much higher, much higher. Thank you for that. That's a great question, Dushima. Thank you.
Yeah, thank you so much for the answer.
Yeah, you're very welcome. You're very welcome. I do see a question here from Amber May. How do you deal with clients who disbelieve Western medical sources in medicine when they're only engaging in healthcare adjacent care? That is well, Amber, you probably saw within some of the information I was sharing that quite a number of the parents and caregivers in the studies that we included did talk about a departure from allopathic medicine or Western medical sources to wanting to provide naturopathic or homeopathic modalities for health. Do I find this difficult in practice? Yes, I do. As a nurse practitioner, it was quite common when I was working in BC for patients to come in and ask for me to run a whole host of tests as advised by a naturopathic physician, but they would have to pay for it if it was ordered by that physician. So then I would make that fill out the lab form for them. And I was looking at some of the tests, and just in my own mind, I thought to myself, what are these? If I provide the requisition for this, I'm responsible for these results too. And I'm not even sure about what some of these tests are for. I do believe, though, that people that want to engage in other forms of healthcare, it is a symptom of some of the problems we are having in healthcare. When people lack accessibility to a primary care provider or they're not attached at all, people will look for alternatives. And something that naturopathic and providers of complementary and alternative modalities can give patients is that more personalized, individualized kind of care, which people often really like. They're much, often folks are much more in favor of that over generic public health recommendations for routine immunizations that are given to everybody. I approach it as trying to understand what it is about the care that they are receiving, that they felt that they wanted to see a naturopath about. Some of the naturopathic physicians that have been in my communities have been really good, especially at working with patients that have allergies, food allergies and such. So I see the strengths in that as well. I keep trying to keep the relationship intact. I just continued to build a bridge, and I even when I hear ideas that I know are not based in evidence, I still remain open to seeing those patients and chatting with them. When a provider like myself reacts really negatively to someone who is trying other health modalities, I feel that we reaffirm a fear in them, that is who we are. We are all or nothing, you do it my way or the highway kind of approach to care. And my focus in healthcare is not being patient-centered. My focus is being relationship-centered. And I know this diverges from everything you've ever heard from a nurse, but my focus is understanding my relationship with my patients and clients and their relationship with me and trying to keep it intact, which they have the freedom to try other sources. So I just listen, hear them out, provide my own perspectives, and remain engaged with them. That's my approach. Thank you very much. That's a great question, Amber.
That's great. Thank you very much, Christine. Okay, we have a couple of questions in the Q&A, and a couple of them are combined, and you've actually spoken to this a little bit in responding,
Yeah.
but Donna had asked, has vaccine hesitancy since COVID increased or decreased with routine immunizations? And Carolyn had also sort of asked about that because she is a public health nurse in Regina and has seen fully vaccinated children now decline their grade 6 or grade 8 vaccines. So again, what is the statistics around the numbers? And then again, how do we encourage these families to, stay in contact, which you've already talked to a bit?
Yes, that is accurate. Like I mentioned at the beginning, this is not something unique to this province. It's not unique to Canada. It's something that we're seeing in research that takes the broader view of vaccine uptake in children worldwide. Uptake has decreased since the pandemic. Now, some of that can be due to the fact that during the pandemic, people were not able to get their children vaccinated. There wasn't the opportunity, but there is also the understanding that some of this is due to growing vaccine hesitancy, fueled by the mistrust that people felt during the pandemic towards governments, ministries of health, that this has now led more people to question vaccines for their children. We are seeing that right now. I think that the measles outbreak that we're seeing throughout Canada right now is very much reflective of this lower uptake of the MMR vaccine. And I think at the beginning of the pandemic, I was in the midst of my PhD research, and I remember thinking, this is like the worst time to be doing this PhD research because it felt terrifying for me to see my topic kind of blown up in this way. And at that time, I kind of thought to myself, either this is going to get people more on board with vaccines, or it might actually impact uptake of other vaccines unrelated to COVID-19 immunizations. And that's what we've seen, is that we've seen that declining uptake. And I think this is representative of some of these contextual pieces that we are seeing outside of people's mistrust of governments and questioning. I would like to see, in terms of solutions, a lot of the evidence about how, as healthcare providers, we address this. The best evidence is for motivational interviewing, and some of the preliminary research was done here in Canada, and it's being replicated in other places in the world. I'm very proud of the work that's been done in Quebec on motivational interviewing with parents that have just given birth to a new baby. I think that there is, and I think that motivational interviewing really follows the thread of what I've shared with you here today, is that it isn't just sharing information, it's acknowledging people's fears, it's asking them more questions, it's seeing both sides to this issue and keeping a relationship intact. But the healthcare provider side of me, who still practices, understands that it's difficult within how the system and the stress that we feel as healthcare providers to incorporate something like motivational interviewing, with the understanding that interventions like this take a lot of time and effort with healthcare providers that are caring for people who are very ill for many different reasons right now and are lacking attachment. So yeah, that's a long answer to a short question, but yes, it seems that the rates are going down.
Great, thank you. I see Toshima has, so Caroline, I'm assuming your question was in the chat, so I will maybe pass on you, but Toshima looks like she's raised her hand again. So I will just ask her to unmute.
Yeah, I have another question. This one is not about the kids, it's about me. Like, I want to know, I know there's a vaccine that protects women against cervical cancer and cancer.
Yes.
So, like, I don't know how to get it in Canada.
The HPV-9 vaccine, yes. And so that is a vaccine that protects against 9 strains of the human papilloma virus. It's a 2-dose schedule. It's offered 6 months apart. Dushima, what I would do is find out what is the closest public health clinic in your area. Call them up. I know, depending, because I come from another province, I understand what some of the limits for funding, depending on the province you're in, depending on your age, what vaccines you've already received. But I would call up your local public health center and ask them about the availability of the HPV-9 vaccine, and see if you are able to receive it, or if there's a cost associated with it. But I do think, depending on the age in Saskatchewan, that you can receive it for free.
Okay, thank
Yes.
you.
You're very welcome. You're very welcome. I do see a couple questions here. Amber May had asked about, do you have any advice about dealing with clients who believe vaccines cause autism specifically? Yeah, oh, Amber, it just won't go away, will it? That claim. And I think the really unfortunate pieces is you would not believe the millions, maybe even billions of dollars that have gone into research to dispel that claim. And not just done by pharmaceutical companies. This has been done worldwide by academic institutions that wouldn't have a vested interest or a bias on this topic. No one has been able to replicate that, but that evidence just seems to not be as compelling with our clients. I still advise taking a look at the motivational interviewing approach with clients who believe that. Where so when did they become aware or asking? So vaccines causing autism. Where have you heard this? And what kind of information, which specific vaccines do you think cause autism? I would just ask a lot of questions about their background. It's also has helped me to understand if they have anyone in their world, like a nephew or a neighbor or anything who has a child with autism. I really try and, I don't think evidence because we have the evidence to show that there is not a causal relationship. I don't think evidence alone is going to dispel this, but I do think just trying to find out where people are at and remain engaged and continue to offer. I had a patient from a number of years ago that didn't vaccinate all of her children. She lives in the lower mainland of Vancouver, and with the outbreak of measles, I actually reached out to her and she's no longer, and just said to her, do you have any questions? Like, I know we differ on this, but I'm just worried. She has a younger child who's not vaccinated at all. And I reached out to her and she said yes, she was going to consider getting the MMR vaccine because she was concerned. And I thought if I would have just kind of ignored her or not kept that connection, then it wouldn't have happened. So please take a look at some of the evidence regarding incorporating motivational interviewing as just a way to get the conversation going and find out where people are at and then continue remaining engaged. Um,
Just before you go to
just,
your next question, I
yes.
just want to say the Saskatchewan Prevention Institute does offer motivational interviewing training. I don't have dates on an upcoming session, but if you take a look at our website, we run it several times a year, and so it may be of interest. And we generally offer it at a fairly reasonable price. It's try to make it as available to people as many people as possible. Sorry, and I know there's another
No,
question here in the
thank
chat.
you. That's wonderful. So I just wanted to point out here, Sarah, thank you. I actually just grabbed off the side. I have my Saskatchewan vaccination schedule right here. So thank you for sharing the information that HPV is available in Saskatchewan. It's publicly funded until your 27th birthday as a 3-dose series. And I see that here on the schedule here. I appreciate you stepping in to provide that information for me. Jillian had a question here. How do we as healthcare providers manage the misinformation that people find on social media regarding vaccines? People that have fully immunized older children now refusing immunizations for younger children deny concerns about vaccines. Yeah, I'm seeing that too. I'm seeing that step down approach to vaccinating, where if you have a family, say 2, 3 children, you'll find that the older children have more vaccines. And then as people have more children, they're giving less vaccines to the younger children. The misinformation on social media regarding vaccines is a huge problem. A huge problem. I can say as an educator, I educate nurse practitioners. I get asked questions about information that is not supported by evidence about the necessity of a lot of other things as well, because of people's engagement with health-related information on YouTube and TikTok. And what's even more frightening is that in health-related information, I was reading about this in the news recently from YouTube, is often being used by AI and replicated when people type in AI related questions. and looking for information, it's pulling from sources from YouTube that may or may not be based in evidence at all, and people find this information compelling. I would ask questions, Jillian, about which social media, I mean, influencers or sites they are, especially on YouTube, any channels that they're following, and ask specifically about, that information, and have a look at it yourself. To ask yourself what is being purported here, what makes this information source so compelling. And the reason I say that is because the research that we have about vaccine related arguments that you see on social media shows that it is very diverse. And this is probably why we don't have a set in stone, like a good intervention for addressing this yet. There's a paper, it was written in 2023, that looked at the taxonomy of attitude roots for opposition to vaccination. And those authors pointed out conspiracy ideation, distrust, unwarranted beliefs, worldview and politics, religious concerns, moral concerns, fears and phobias, distorted risk perception, perceived self-interest, epistemic relativism, and reactance. That is how the debates and the arguments against vaccines have fit into one or more of those kind of argument roots. So you see, when it's that wide, like, how does one come up with like one way to dispel this? So my advice would be to look and see, or get a handle on what some of your clients are looking at in social media. Take a look yourself to see what is the story, and then ask people so based on that information that you received from TikTok or whatever, what are the questions that you have for me based on that? The other thing I do encourage healthcare providers to do when they feel comfortable to do so is don't be afraid to share your own experiences. The evidence we share and the approaches we take to our discussions can always be argued against in terms of people saying they don't trust that source that we are citing. But our own personal experiences of providing vaccines, my own personal experiences of seeing children with vaccine preventable diseases, and my experiences of vaccinating my own children, no one can argue against that. And so our personal narratives in this do matter. And I understand that not everyone is comfortable to do that with their patients and clients, 100%. But if you do feel comfortable and confident, that is often very much more compelling for parents and caregivers declining vaccines than our evidence. Yeah.
Thank you. And this follows along the same thing that, but Carolyn has made, a couple of really good points. She says, how do we talk with families, especially after the president of the USA is promoting not vaccinating? How do we respond to this because of this influencing country? And also, just even the information now that is on CDC and just find that that used to be a go-to all the time, but now I'm not trusting of some of the maybe the newer stuff, or questioning what's being posted there. So
yes, I saw that take place. I'm part of a immunization research network where that information was shared with us on the shifts that took place on the CDC website in the information that was being shared. And this is devastating. This is absolutely devastating to see that. And for researchers in the United States that have spent a career looking at this issue and promoting vaccines, I can't imagine what it feels like to have a very trusted organization like CDC amongst healthcare providers shift gears and provide this kind of information that contradicts their research or their evidence on vaccines. The political piece to this is also a huge issue as well. There's a wonderful paper published in Vaccine recently. The authors are actually here from Canada, Anoni MacDonald, Ev Dubé, and Janice Graham. They wrote a paper on commentary on political vaccine hesitancy, not new, but a growing problem. And they talk about governments using this as a platform to connect with constituents or connect with more voters by making recommendations that diverge from healthcare providers, from public health, and from evidence. It's there. It is. And so political ideology has become one of those taxonomies of vaccine opposition, one of the arguments that people, when they affiliate themselves very strongly with a particular political party or ideology, then, but vaccinate might also kind of shift based on their connection to these particular political groups. I think we just have to continue what we do as healthcare providers, showing our patients, our communities, that we care about them, that we care about their health, and this is our stance on this topic. Yeah, very good point.
Thank you so much. I don't see any other questions currently. It has been a true pleasure having you present and answering our questions. And I just really so appreciate your stance on just how important the relationship is, how we need to listen to and I see that as the way that we are going to reestablish trust. That if people are feeling that their voices are being heard too, and just continue to make those connections. And hopefully our goal is always healthy children. And so, definitely vaccines are extremely important in life well-being. So
Thank you so much, Jackie. I hope I'm glad you took home that message here. I spent a lot of time outside of this country working with people in very difficult, marginalized, desperate circumstances. And the one thing I learned from those experiences when I returned here was maintaining relationships, building bridges to people, and trying to find common ground, even when we disagree on big things like this. I find that is what holds people together in difficult times, is keeping relationships intact, even when it's tough. And so, though I definitely can commiserate with healthcare providers that are really stressed and seeing really sick people and having vaccine hesitant parents come, you're just like, oh, come on. I also just really implore you to put forth that effort to keeping the connection to them, to definitely help in hopefully promoting vaccine uptake in the future. So thank you to, I see Amber, Jennifer, these are thank you for your kind words. Again, a huge thank you to you, Jackie, and to Jody for having me today. I appreciate giving me this platform to present my work. And yes, moving forward, I wish everyone the best in their care and work with the parents and families and caregivers.
thank you so much. I'll be sending out the recording link as soon as it's available. Thank you again so much for joining us, for taking time. I know everyone is always so busy, but this is such an incredibly important conversation. And I hope you've enjoyed the session as much as I have. So have a wonderful day.
Take good care, everyone.